Breastfeeding will prevent pregnancy. We hear this all the time.
Your vagina will become loose after giving birth. I really do think this is a myth and one that we hear quite a bit.
My favorite. Once you have one C-section, you'll need to keep having them.
One C-section doesn't mean always a C-section.
I'm Dr. Laura Riley, and I'm the chair of OB-GYN at Weill Cornell Medicine and New York Presbyterian Hospital. I'm a high-risk obstetrician, otherwise known as maternal fetal medicine specialist.
And I'm Dr. Dena Goffman. I'm the chief of obstetrics at Columbia University and New York Presbyterian Hospital. I'm also a maternal fetal medicine physician, and today we will be debunking postpartum myths. Your baby bump disappears after you give birth.
We wish. Your baby bump is probably going to last several weeks after birth, so don't bring anything too tight to the hospital to go home with. You still have the baby bump because your uterus does not completely contract down to its normal size after having a baby.
There is normal weight gain in pregnancy, which isn't lost immediately. Decrease in bowel function. Everything needs to sort of take time to move back towards normal. So don't be discouraged if it takes time for your baby bump to disappear. Your vagina will become loose after giving birth.
There may be changes in the short term, and they'll say, oh, it just doesn't feel right. You know, my answer to that is just give it a little bit of time. The blood flow to the vagina is great. And so it's gonna heal really quickly. Those lacerations will heal, but it may take a little bit more time for some of the swelling to go away, but that's gonna all get better within weeks.
The other thing I would add is that there are muscles in the vagina, and those muscles may not have been used as much during a 9-month pregnancy or the immediate postpartum period, but they can also be strengthened and improve over time.
You can have sex right after childbirth.
So this is a myth. I can assure you that you won't want to have sex right after childbirth, no matter what your birth experience is. For most patients, this isn't something that they're thinking about doing in the immediate postpartum period.
Yeah, I think that there's kind of two parts to this. One is comfort. It's unlikely that you'll be comfortable. But the other reason is sort of a safety thing. If your cervix is open, which we know it will be, our concern is that the organisms in the vagina will get into your uterus and increase the likelihood that you get an infection. And so that's part of the reason that we tell people don't have intercourse until the bleeding is completely stopped.
Oh boy, okay.
How bad is it? Breastfeeding will come naturally.
Many patients, after having gone through pregnancy education, childbirth education, and lactation education, still feel like they're supposed to know how to do this as soon as they have their newborn in their arms. And I would just really want to debunk that myth that somehow we're born to know how to breastfeed.
I remember my own frustration. I thought, I've been a physician for 6 years. I've done all the education and I've educated other people. And then I get this baby and the breastfeeding. It felt like a disaster. Breastfeeding is a process. You gotta be patient with yourself. You gotta be patient with your baby. And sometimes it's working and you just don't believe it. The way you know that the breastfeeding is working and your baby is getting enough is weighing your baby. You go to the pediatrician and the pediatrician says, your baby looks beautiful, baby's gained a little bit of weight, or your baby's not continuing to lose weight, and your baby's not jaundiced. All those things point to the fact that the breastfeeding is working.
And I think sometimes our patients feel like because it's breastfeeding that they're single-handedly responsible for this piece of the newborn's life. I like to make it a team sport where everyone's participating, to have someone else do some of the other stuff. The burping, the changing, putting down to rest while you actually get some rest so that your body can do this important work. Breastfeeding will help you lose all the baby weight quickly.
You do need to increase your calories, but most people will burn somewhere around 800 extra calories a day in breastfeeding. That is going to help you lose the weight. I just wouldn't say it's going to help you lose all the weight.
Breastfeeding is wonderful, but it's not magic.
Patients will come back at the 6-week visit. Why am I still holding on to this? It took you 9 months to put this weight on. It's going to take some time to take it off. 4 months, 6 months for most people. Is it normal for nursing to hurt?
It's not normal for nursing to hurt. It shouldn't be excruciating or painful. I think there are discomforts in the initial period. Getting your newborn to latch appropriately is a new sensation. And then the first time the milk lets down, that's another new sensation.
I hear what you're saying, but The very first time that baby latches properly and puts a huge amount of suction on an area that is incredibly sensitive, that is not nice. I think that that's pain, but the issue is it initially is uncomfortable and then it starts to get better. It shouldn't continue to hurt for weeks. So if it is seriously painful, that's when you want the consultant to come in and say, is this baby properly placed? Because if the baby isn't properly placed on the nipple, it really will hurt. You can get little cuts. You don't want to go down that road. I tell people to get frozen peas. That cold will help reduce some of that discomfort and engorgement, and will actually conform to your breast, and you can just plop them right into your bra.
Your milk supply can't be improved.
Your milk supply can be improved.
Your body makes milk when it perceives the need for milk. So the more you put the baby to the breast, or a high quality pump that can do almost as well as a newborn to drain what's currently in the breast, is the signal for your body to make the next batch of milk. You just have to keep feeding, stimulating, telling your body that there's a baby here who needs milk, and your body will make it. Your body learns that habit, which is just fascinating to see and to have experienced. It really is about breastfeeding regularly, pumping, and then paying attention to the fact that hopefully you're not dehydrated, you're not overly stressed, you're not running around doing all these other things that can make it hard for your body to continue to keep up.
Breastfeeding makes your baby clingy and dependent. Myth.
This is definitely not true. Breastfed babies end up needing you for those feeds, but the feeding doesn't mean that they need you more. If you're exclusively breastfeeding for the first 8 or 12 weeks of a newborn's life, they will be with you during those feeding sessions. They're very frequent when they're little. I don't think that necessarily means that the babies are needy or clingy. It's just a function of the fact that that's where the breast milk is. Once breastfeeding is well established, there is definitely a role to pump and have someone else feed breast milk in a bottle, offload some of that breastfeeding with other support people and family members. The next myth is you shouldn't nurse if you're sick.
Not true. There's very few instances where we will say you should not nurse. If you're sick, the good news is that you are developing antibodies to whatever it is that made you sick. Those antibodies then get into the breast milk and are transferred to your baby and will actually protect your baby from getting that same infection.
I think we've learned a lot in the last year and a half about hand hygiene. If you're sick, you should use those hygiene strategies and continue to nurse your baby so they get the antibodies that you're producing.
And we would suggest that you breastfeed unless you're told otherwise. Breastfeeding will prevent pregnancy.
So this is another myth that we've certainly seen people get in trouble with. So breastfeeding is not a form of contraception. It is not a reliable form of birth control. When you're exclusively breastfeeding in the early postpartum period, you are less likely to resume menstruation and ovulation. But when that resumes for different patients is different, and it's very hard to predict. And so if you are having unprotected intercourse, even if you're breastfeeding, there is a chance that you will conceive. We've unfortunately seen people who have conceived and not realized it because they were under the impression that this myth was true and that they were protected.
Breastfeeding is not a form of contraception. We have a whole list of other opportunities for you. Everyone gets postpartum depression.
Postpartum depression is quite common, more common than we previously recognized or acknowledged, but definitely everyone does not get postpartum depression.
People who have anxiety or depression prior to pregnancy are at particularly high risk.
Postpartum depression is really something to keep on your radar for those first 6 to 8 weeks, and not something that you should dismiss if it doesn't happen right away.
Although few people will get postpartum depression, more people will actually experience baby blues. Baby blues we think of as feeling down in the dumps or very emotional or very anxious for about 10 days, max 2 weeks after the delivery. So if you're still feeling super anxious, really depressed, not normal in your own skin, I think that it's really important to speak up. If it's 3 weeks after delivery, 4 weeks after the delivery.
And while we think postpartum depression does have a hormonal component, it doesn't mean that the support person is free of that risk. So I think that's a more recent recognition on our part, and we want to be mindful of that risk for support persons and partners as well. You will immediately fall in love with your baby.
We know scientifically that there are hormones and peptides in your brain that stimulate that bonding experience and that natural love. But I think there is also the competing life, like fatigue, feeling like you're not in control, that can sometimes make that love seem a little less lovely.
I think how you emotionally respond to having this new person in your life is different for everyone. And so how you will feel about your baby week 3 versus month 3, it's a process and it evolves. You will love your baby, but it may not be sort of like the commercials that you see in those initial few weeks.
Once you have one C-section, you'll need to keep having them.
This is a myth. One C-section doesn't mean always a C-section. This has to be really individualized counseling on what happened the first time and what's safest for you and your future babies. The vast majority of patients who end up having a C-section for their first birth will have the type of C-section where you do have the option to have a vaginal birth with the next pregnancy. These are things that you will need to talk to your provider, understand why you needed a C-section the first time, which can actually help you predict the likelihood of success with a future vaginal birth.
And I think the other thing that goes into the decision making is sort of, what do you plan reproductively? 1 more child, 5 more children?
The right birth for you really depends on you and your baby and what's happening. And I think we have to recognize that the best birth for each patient isn't the same. You won't have vaginal bleeding after a C-section.
You will have some vaginal bleeding. You are going to have less generally after a C-section. Part of the reason is because when we do your surgery, we try and wipe out the clots and things that are in the uterine cavity.
So the other thing to know is that the blood flow to the uterus is dramatically increased during pregnancy, supporting growth of the baby, supporting the placenta, and that after the birth, that blood flow to the uterus decreases gradually over time. So this is why you have extra blood flow that continues and then gradually tapers off as the uterus is shrinking back down towards normal size. Severe headaches are normal when you're postpartum and overtired.
That's actually a myth. Mild headaches or a headache after delivery is something that you might anticipate just because you're tired, you're hungry, you're stressed. I think severe headache is what should be actually a red flag. If you've got a headache that's so horrible, you're saying, oh my gosh, I can't stand this, you know, your vision's a little off, or you're a little nauseous because you have such a bad headache, or you've taken some Tylenol and this thing is still throbbing, call somebody so that we can check you out.
In addition to a severe headache, if you have severe nausea and vomiting, upper abdominal pain, severe pain or swelling in your legs, severe shortness of breath, chest pain or fatigue, increase in that bleeding that we talked about, more than has been going on in the last few days. For us, these are warning signs that actually could be representative of a serious postpartum complication. If you're not seen by your obstetrician, we want you to let an urgent care or an emergency department know that you've been recently pregnant and that you're postpartum, so that they can help think through some of the pregnancy-related concerns.
I love this one. It's better to have kids one right after the next.
Yeah, so this is a myth. We talk about what's the right timing, and I think the answer is not going to be the same for every family, every situation, but I think what we know medically is that having those kids one right after the other doesn't give your body the chance to recover. And so what we typically think about is about 1.5 years between pregnancies in order to allow that healing, that weight loss, that healthy weight, exercise regimen, so that you can go into a future pregnancy really having healed and recovered from the first.
There are studies which show your risk for complications in the next pregnancy are actually higher if your children are closer than that 1.5 years time. So there's a higher risk of having preterm delivery, higher risk of some bleeding complications. So there's real good reasons why you kind of want to space that apart. The first 10 days are going to be tough. You just got to be patient with yourself. It is going to get better.
You really need to ask for help, don't hesitate, and really take care of yourself and your baby. You've got this.